Hello everyone, this is B. Chandana from Geetanjali College of Pharmacy. Today I am going to explain the topic on monkeypox viral disease. Monkeypox is an emerging zoonotic disease caused by the mpox virus infection, which affects both humans and animals. The virus was first discovered in monkeys in 1958 and has been since detected in a variety of animal species. The first human case of mpox infection was diagnosed in 1970 in the Republic of the Congo, located in the Central Africa. Subsequently, mpox has predominantly circulated in the Central and West Africa, with the transmission occurring between animals as well as between animals and humans and through humans to humans contact. The main objectives of the mpox virus include introduction, etiology, pathophysiology, clinical manifestation, diagnosis, treatment, and the prevention. The introduction of mpox virus is mpox, formerly known as monkeypox, is an infectious viral disease that can occur in humans and other animals. It usually causes a rash and flu-like symptoms. The disease is caused by orthopox virus monkeypox, formerly monkeypox virus. Pox is endemic in Central and Western Africa, where several species of mammals are suspected to act as a natural reservoir of virus. The subtypes of monkeypox virus are Congo Basin, Central African clade, that is clade 1, and the West African clade, that is clade 2. Monkeypox virus is an enveloped double-stranded DNA virus with a genome size of around 190 kb. Monkeypox virus is a viral zoonotic disease that occurs primarily in the tropical rainforest area of Central and West Africa and is occasionally exported to the other regions. The incubation period of mpox virus is most mpox patients become symptomatic within 4 to 11 days after infection. The incubation period can be last as one day. The 2022 to 23 outbreak revealed that incubation periods of up to 4 weeks are possible, with 5% of cases having incubation period longer than the previously assumed 21 days. The subtypes of mpox virus is there are two subtypes of mpox virus, that is clade 1 and the clade 2. The clade 1 is endemic to the Central Africa. It tends to cause more serious illness than the clade 2. Recent outbreaks of clade 1 have been less deadly. The clade 2 is endemic to East Africa. There have been a global outbreak of clade 2 mpox since 2022. It's less likely to be fatal than the clade 1. The stages of the mpox virus include there are 5 stages of the mpox virus. The first one is a maculae. The rash starts as a flat red spots, last for 1 to 2 days, and the second stage is papillae. These spots become hard raised bumps, last for 1 to 2 days, and the third one is vesicle. The bumps gets larger, they look like blister filled with clear fluid, last for 1 to 2 days. Stage 4 is pistulae. The blisters filled with the pus last for 5 to 7 days. And the last one is a scabs. The spots crust over and become scabs that eventually fall off, last for 7 to 14 days. Coming to the etiology, animal to humans, direct contact with infected animals, example rodents and primates. Human to human is close contact with infected person's body fluid, skin lesions or contaminated materials. Mpox is primarily transmitted to humans through contact with infected animals. The virus can be spread through several routes. Coming to the pathophysiology of mpox virus, mpox virus begins with the transmission in the host, which could be a result of human to human or animal to human transmission. Mpox virus, like the smallpox virus, infiltrates the host system. Mpox virus begins to replicate at the site of the inoculation, which is a respiratory or oropharyngeal mucosa. The virus enters the bloodstream after replication, resulting in the primary viremia. During primary viremia, the virus spreads to the local lymph node via monocyte cells and replicates again. Following replication, the virus enters the bloodstream, causing secondary viremia. The virus spreads to the other organs such as the skin, lungs and gastrointestinal tracts, where clinical signs and symptoms of the disease manifest. Infected people are thought to be most infectious during secondary viremia phase, also known as prodromal phase. Coming to the clinical manifestation, the symptoms of mpox are significantly discussed, including the common symptoms and symptoms related to the characteristics of rashes in the mpox. That is fever, rashes, enlarged lymph nodes, chills or tremors, headache, muscle pain, backache, fatigue and joint pain. In this diagram, you can see the more symptoms such as severe headache that lasts for 0 to 5 days, high fever from 0 to 5 days, lymphadenopathy, skin rashes, chills, lack of energy, backache, muscle aches, etc. The diagnosis of the mpox virus can be challenging due to its similarity to other viral infections. Diagnosis is typically confirmed through laboratory tests, which may include polymerase chain reaction testing. This is the most reliable method for detecting mpox virus DNA in the clinical samples such as lesions, blood, or throat swabs. Serology blood tests can detect antibodies produced in the response to mpox infection, but these tests are less commonly used. Next one is virus isolation. In some cases, the virus can be isolated from clinical specimens in the specialized laboratory. And the next test is ELISA, electron microscopy immunohistochemistry. The treatment of mpox virus. There are not any approved antiviral treatments for mpox. If you are very sick or if you are pregnant, your provider might treat you with antiviral drugs like tecovirimat. Vaccinia immunoglobulin, a type of antibody treatment, is also sometimes an option. These drugs are approved to treat other viral infections like smallpox and could benefit some people, but researchers are still studying how well they work for mpox. Most people recover from mpox within few weeks with supportive care, including pain management, fever reduction, keeping the skin clean and dry, adequate fluid intake. Severe cases may require hospitalization. Coming to the complication of mpox virus, complications caused by mpox can be include bacterial infection, which may lead to the sepsis, loss of vision or eye damage from mpox, ocular infections, myopericarditis, that is inflammation around your heart, encephalitis, that is inflammation in your brain, pneumonia, respiratory distress, that is extreme difficulty breathing and getting oxygen to your body, and the next one is severe scarring. The preventive methods include the vaccination. While specific mpox vaccines are not widely available, smallpox vaccines like JYNNEOS can provide some protection. The JYNNEOS vaccine is recommended for those at a high risk, and getting both doses provides the best protection according to CDC, that is Central Disease Control. Post exposure prophylaxis with vaccination is recommended for individuals who had contact with mpox cases according to CDC. Vaccination can be administered up to 14 days after exposure according to the NIH. And the second preventive method is avoid close contact. Avoid direct or skin to skin contact with people who has a rash that look like mpox. Don't share personal items like bedding, towels or clothing with someone who has mpox. Avoid contact with animals that may infect such as rodents and primates. Good hygiene. Wash hands frequently with soap and water, especially after potential contact with infected surfaces or people, and before eating. Use alcohol-based hand sanitizer when soap and water are not available. And the next preventive method is personal protective equipment. When caring for someone with mpox, wear gloves, mask and gowns. Use PPE when cleaning and disinfecting areas where a person with mpox has been. Other preventive precautions include, if you must be in shared or public spaces, cover lesions with clothing or bandages. Wear a mask that covers your mouth and nose when around others according to CDC. Use condoms during sex as a precaution, says the WHO. Here are some of the images regarding the preventive methods. The first one is hand washing. Avoid handshaking, avoid hugging, avoid kissing, using mask, avoid touching source, avoid gathering, avoid traveling, stay home, clean contact surfaces, isolate yourself sick, work from home if possible. The reference of my topic is from Cleveland Clinic, World Health Organization, Mayo Clinic and Central Disease Control. I hope this topic may helpful to you. Thank you.